and we send them back home. It's for free. But we also have other services. Cleft lip. You can see this beautiful lady here. This was day 1 post-op. By now, her lip will be very beautiful. You don't even know that she had that. Probably she'll have a line. Clubfoot. Do we know Liverpool, football, Liverpool, for those of football manics, right? Steven Gerrard, he was actually born with feet like this. And he was the best player. But in developed countries, when a baby is born like this, immediately they start to do treatment. And this is what as CCBRT we're doing. So we want to make sure by this child, by the time they get to age to go to school, their feet are corrected and they can go to school. We also do ophthalmology services. Actually, we're very famous by our eye work. Let me tell you, mtoto wa jicho, you've heard of cataract, right? If a child is born, a baby is born with cataract, if we have not done surgery at a certain age, you'll never reverse that sight. So they will go blind. So early identification. As soon as that baby is born with a white dot, have to do surgery, they will go blind. The other thing that we do, we have a prosthetic. You see this young boy? He's actually born without legs. So we have a workshop where we make prosthetic limbs so that these children can start practice using them and they can start, being like normal kids. Some of them, they even play football with their artificial artificial limbs. The other thing that we do, this young man here, we make customized artificial eyes. There are those who are born without eyes. There are those who have cancer of the eye that want to remove the eye. But then we make a made eye, which looks exactly like the other eye, just to reduce stigmatization in the community. The other thing that Asha spoke about is rehabilitation. Majority of our children we see are children with cerebral palsy. I'm going to say something in Swahili. We usually heard, mtoto ajalia. Sindio, eh? When mtoto ajalia, that means probably they'll have some injury in their brain. So they'll end up with a disability. So what we do lifelong rehabilitation for these children to make sure that they can, even slowly, but they can start doing their milestones like no more kids. The other thing that we have is development programs. So people with disability, they are our people. We do a lot for people with disability. We create awareness and advocacy. We even get welcomed in government as a technical advisor on matters to do with disability. Do we know there's a Disability Act of 2010 in Tanzania? If you are an employer and you have 20 or more employees, at least 3% of your employees should be people with disability. Did you know that? Yeah? Anna, how many do you have? What is your percentage in your organization, right? So these are the questions as Pan-Africans we should ask ourselves. Are we inclusive? So inclusive is not only gender, but people with disability. Are we giving them opportunities? At CCBRT, 6.5% of our staff are people with disability. We have doubled the requirement of the law. And we're talking about from skilled leadership roles to lowest in the organization. The other thing we do, in Moshi, those who are coming from Moshi, Pasua, we have a beautiful rehabilitation center for children to rehabilitate them. Mabinti Center, this is a specific program for women who had fistula. After treating them, we give them skills so that when they go back home, they make products so that they can sell them. We empower them economically. We have a shop at Slipway. Those who go to Slipway, we have a shop. You've seen it? Yes. And then even Palace CCBRT, at CCBRT we also have a shop. The last program that we have is an academy because it is our responsibility to build capacity of human resource for health in Tanzania, not only for CCBRT staff, but also outside CCBRT. Now, we talk about free and subsidized. There's free, right? Somebody has to pay. That's where now the social enterprise journey began for CCBRT. So social enterprise, let me just try to break this down, yeah? Because sometimes maybe we've heard the word social enterprise, but we don't know exactly what it is. It's simply doing business for social good. It's not about sharing profits. It's about you take them for social cause. And this is CBRT, we started the journey in 2018, whereby we said, okay, we can no longer continue depending on donors. Because donors, one day, they will say, we don't have money for healthcare. We can close the doors. So what we're doing as CCBRT, oh, that's me, model in my part-time job. That is our private clinic. So CCBRT expanded our private services, and some of you are actually our clients that I've seen, where they come to get private healthcare services, and the money that we get, it goes back to subsidize to pay those you at the beginning. We accept almost all insurances, of course, and cash for those who want to come to get our services. And it is more of a clinic, so from dialysis to dermatology to dentistry and so on and so forth. So now, social enterprise for us, even for our programs, we incorporate the business thinking so that we can generate income to go and subsidize those who cannot afford to pay. The main are 100% of our operations, we were depending from donors. By 4% of our own revenue cover our operational costs. So we've made progress there. Now, from the 28 years, coming from a donor charity mindset to become a social enterprise, it's a journey. Because one mentality is we need to spend money, while the other mentality is we need to make money, right? We had to go through a lot of mindset and culture change at CCBRT. When I came on board as a CEO, this was one of my biggest challenge. And if you're asking yourself, this is why I do not have hair, okay? It's because I had to deal with this culture change. Culture change is not easy. It's not a switch where you can just switch on and off, right? It takes time. Culture change comes from behavior change. How can you change the behavior of people? That means you need to set up systems to force that behavior change so that you can change the culture. Some of the things that we had to do is to put a management system. We had to look at 3 Ps. Everyone had to make sure that we know what is our purpose as an organization. So the first thing I did, I asked the 33 managers and heads of department the same questions. The same questions, just to make sure where are we? Because sometimes as leaders, we think everybody understands where we're going, while actually they don't. After asking those questions, these 3 Ps came. Purpose, people didn't really have an understanding of what our purpose was. Some talking about vision, some vision. So it was very important as a leader to really define what our purpose is. And our purpose is that we are a learning organization. And the beauty about learning is a journey. It's continuous. It's an event. So that is my challenge to you, my Pan-African sisters and brothers, that every time you think about an improvement, it should be something that is continuous. The other thing is, the other P is people. Everyone was so used with job description, right? This is my job description. I only do what is in my job description. But no, we have to think about the role. What is the role that you're sitting on? Which is more than what is actually described in the job description. The last P, it was our processes. For social enterprise, we had to change our processes. The processes had to read with the thinking of a business-minded enterprise. So we have a newest edition. Did we all see the Samia Suluhu Hassan maternity wing? Yes, thank you. So even though aliniambia kwamba nimemchomekea calling to wing her name, of which I did, but anyways, we have now embarked in maternity services. We're blessed to have Her Excellency open this new wing. And the purpose of this is to really reduce maternal mortality in Tanzania. Still, many women are dying during giving birth. So the purpose is to use this in the region of Dar es Salaam. Phase 1 of this, it was really to strengthen 22 public facilities in Dar es Salaam, to increase their capacity, to train them, but also to capacitate them. Again, our mission has not changed. Our mission is to serve the most vulnerable. So there are 3 groups of women we want to make sure cost should not be a challenge to them. 1, women with disability. Women, the infrastructure in delivery rooms in Tanzania, unfortunately, friendly to people with disability, women with disability. They will go to deliver, the infrastructure is not friendly. So that is one of the things that we were very intentionally when we built this new facility. Again, the social enterprise, apart from the most vulnerable, we have a wing for private services. For private women who want to deliver, who are self-referral and private, we have that wing for them. We have 8 delivery suites. Now, this is also something new in, I don't know, in Nigeria, my sister in Cameroon, but in Tanzania, most of the time women do not deliver with a companion. To hear the news. This now, we have these 8 rooms where a woman can choose who her companion is, whether it's the husband, is the mother, is the sister, and this is something that it was new, and but they're coming around to it. Just hit our 100th baby that delivered the CBRT, and was born on my birthday, and it's a girl. But unfortunately, she's not called Brenda, but it's okay. At full capacity, we can deliver 12,000 deliveries a year. And it's 160-bed facilities. Improve the maternal space in Tanzania. So on that note, I just want to show you a brief video of the facility. This is where technology fails.
Tanzania. Nakupenda kwa moyo wote. Nchi yangu Tanzania, jina lako ni tamu sana. Nilalapo na kuota wewe, niamkapo ni wewe.
okay. It was finished anyway. Yeah. Okay, yeah, you can leave it there. So go back one slide. Yeah, so that's all I want to share. But I welcome questions, if any, because it was just meant to be. We're looking for partners, whoever wants to support our work. Running a healthcare enterprise, it's a very expensive affair. And we do not want to compromise quality just because people cannot afford to pay. But as I said, somebody has to pay for that. So we welcome support in any how, and we like to partner as well. So karibu sana, even a learning opportunity for my brothers and sisters from Cameroon or Nigeria. This is for us. How can we improve the health system in Africa? Any questions? Oh, there you go. Feel like I'm a moderator at the same time. Can I? Yeah. Oh, thank you. Thank you.
Tanzania is proud of being African proud. Really. I am so excited. I've never had a CCBRT before. And back home in Nigeria, where I come from, although we have big hospitals as well, but oftentimes when the big boys and girls fall ill, they fly them to India, they fly them to Dubai. London is not easy anymore for us. Either Dubai, India, and I'm going to build the horn when I get back home for CCBR to what you're doing. And, I can see it. I mean, I can see it. And I've seen the CEO. This is really huge. Recently, we all know about this very cruel ongoing Russia-Ukraine war. And many Nigerian young boys and girls who were in Ukraine for medical courses have had to come back to Nigeria because of the war. Okay, thank you. Because of the war. Sadly, they don't have enough hospitals to engage them to continue their practical training and for those who have finished to work in Nigeria. Very, very sad. So I don't know if CCBRT has got enough room to accommodate these young doctors, either for training or to work. That's one. Two, I don't know if CCBRT is actually expanding your skills, this great works you're doing to other African countries. Nigeria, for example, we need to know. You need to speak out for us to know that we actually do have here in Africa great hospitals that can actually treat us and keep us alive for as long as we want to live without us having to fly to Dubai. Thank you.
Thank you very much for your comments. I think the first one, the team from Ukraine and other countries that they really need somewhere to practice. So as a team, we have MOUs with medical schools. So we have certain medical schools that we have MOU because for us, it needs to be very well planned. We don't want a situation whereby today they're there, tomorrow they're not. So in order for us to maintain that level of quality, we have a constant number of students who are coming, different disciplines, from ophthalmology to orthopedics, to technicians making prosthetics, so that the students, they come, they learn, but also they add manpower. But for us, they need to be supervised. Yeah? So it really depends as well where they are in their journey. We have medical students who are doing the MMed, their specialization. So they're already medical doctors, but they're doing super specialization, for example, in ophthalmology. So they come the practice there because for us, I can tell you already, for example, for eye department, every day we see 250 to 300 patients. So they then get exposure with the right supervision because we need that in Africa. Yeah, so I completely agree with you. So for now, we have not gone outside. Balozi tomorrow came to see me. Also, they're facing challenges there. So we were in those discussions as well. How can we have that partnership with Komoro? That is one. Number two, Absolutely. How can we be a medical tourist, right, as CCBRT? And as a matter of fact, as a country, Her Excellency put that very clearly that one of the things that she wants to strengthen is medical tourism. So we've already started as a country as Jakaya Cardiac Health Institute, JKCI, to see how that can go beyond the borders of Tanzania. So as CCBRT, we not yet, because for us, medical tourist, there's certain standards that we need to adhere to, yeah? So we are strengthening our systems first. And remember, we are a social enterprise, so our core business is to serve those who cannot afford to pay. So we constantly seek partners. We cannot generate enough revenue for our own patients, but we seek partners, those programmatic programs that we have. So, but then that's the vision as well. How our vision is actually at African level. It's not Tanzania. So that for future, that is our true north. That's where we want to go. But there's a lot of work that we have to continue maintaining the standards so that when people come, actually they get the service that they expect to. Yeah. Thank you. There is another question here.
Yeah, I just want to let Brenda that mine is not a question, but I want to give you an advice.
Yes, thank you.
You have spoken regarding about the social enterprise and the business enterprise. For them, they say they do it by whatever the profit gets back for to service whatever the services for those people who cannot afford. I never understood or realized that the CCBRT needs support, needs partnership. One of the areas that CCBRT can really benefit becoming a member of a chamber is to assist you to get the right partners to partner with. Even over recent, we got about more than 12 major hospitals from Turkey who came here, and we had a meeting for about 2 days seeking what are the right hospitals that they would like to team up in different disciplines. I never knew CCBRT would have been one of them.
There you go.
Let me say, please CCBRT, become our member. And then it turns to be our responsibility to facilitate, to make sure that we look for the partner and connect you with the right people that you can work together. What they're doing is a fantastic job. I've seen it practically. We had one of our daughter. It's not on this history. It is true they are doing it. And why we should not support you? We have to support you.
Thank
So
you.
that's very critical. I strongly advise CCBRT to be our member. I personally know Dr. Sla, who's your chairman, very serious person. You're most welcome to TCCIA.
Thank you very much. Let me just add one pointer on that. Thank you very much for that comment. The other thing that we're trying to do is to really get the local part and parcel of our work. So the local corporates, for example, because mostly the supporters were development partners. So I can tell you now, actually this year, for the first time, the two major marathons that are happening, NMB Marathon, CRDB Marathon, they are supporting CCBRT work. And this has been part of the efforts on really get the corporates as part of their CSR work to support the work of CCBRT. So again, I will definitely take up on your offer. And did I hear someone from Tigo before? Yes. Yeah, there was someone from Tigo, from that table. Oh, she's not even listening. Hi. So Tigo, they've been supporting us in our club food work. So we need to start those discussions again, right?
Thank you very much. I'd like to congratulate you and your team for a very good job you are doing for our citizen. Is if like the organization want to support, like not like a member, just like NGO, they want to support your work? What is the procedure?
Okay. So we actually have a unit at CCBRT with external affairs, and their job is to really initiate and solidify that partnership. So we have individual donors who wants to donate. There's usually a number that people just can send money, but also we have, let's say, a women group coming to see patients. We have those kinds of partnerships as well. It really comes in different levels of support. Someone might want to support women with fistula. So we will tell them, okay, this is what costs us for one woman to find her from all the way from Kigoma to pay for the transport, to get treatment to go back home. So you can decide, okay, if that's the cost, I want to support 5 women. Yeah. So we welcome any level of support, being individual, being a group, being a company or organization. Yeah. Asante.
I have a question, Brenda, regarding like the human resources for health, because that is where we know that we have a shortage in Tanzania in the health sector. Human resources for health seems to never be enough, because you have people coming in and then moving out again. You know, they go and work for NGOs or do something different, but it's not really directly service-oriented or clinical in any way. But what do you do? Do you train them and then dispatch them out as volunteers, or do you dispatch them while they're still on your payroll? Usually, what is the scenario? And then before you answer that, I just want to share my story. The glasses I'm wearing, I got from CCBRT, and that's where I go, because I love the service, I love the ambiance, it's wonderful. And my son had blowns, and he had his surgery there, and he plays football, he is, it's just like, it's amazing. So I have experienced CCBRT rehabilitation services twice. First, once for my son, and he had serious Blon's disease, Matege. So his legs were bowed, and he had to be operated on. So he had surgery there. And, he hasn't had any problems yet. He's a young teenager now. He plays football. And TCBRT is where I go for my eye care, to get my eyes checked and to get my glasses. So these are from TCBRT. Nice and
I
fashionable.
promise you, I did not pay her to say that.
She
I
didn't
did
even
not.
know.
I wasn't expecting that, Asha. So thank you very much for that.
You're welcome.
Human resource for health, it's Africa. It's not only for Tanzania. Any country you go, one of the challenges in the healthcare system is HRH. So 1, there's not enough. 2, they're not skilled enough. So we, through the academy that we have, we're actually accredited as well to be able to train people, to capacitate people to get credits for their CPD. Yeah? So we have tailor-made programs. By the way, for those who want to do training or mikutano or conferences, they can still use our facility because it's part of our social enterprise. That money that you give us, instead of taking that money to this hotel, you can come to CCBI, right? Because you're going for a good cause. It's going to serve those children and those women that you see. So our role is to work as well also with the ministry to understand where the gaps are. But also we have what we call them skilled skilled personnel, where we train them and then we give them an incentive, not a salary. We don't employ them, so we stay with them. We continue to give them skills before they get employed to go in other organizations. So we're trying to do our part as a CBRT to capacitate HR. Yeah.
Okay.
There's
Thank you very much.
Thank you. I would like to congratulate you as everybody. It's
Asante.
really you have done a great job. I have a question. I'm seeing the infrastructure and they are heavy one.
Yeah.
Yeah, as social enterprise, how have you been able to have all this very first-class infrastructure? And is the government here helping you, subsidizing, supporting what you are doing?
Very good question. Okay, so this particular infrastructure, the new facility, this was a grant, right? So we had some partners, development partners, who supported us with that infrastructure. The biggest partner was the government of Germany, and it was actually a partnership between the two governments, and then we were the implementing partner. So we had the government of Germany who donated as a grant, not as a loan. We also had other players. We had the Swiss in there as well. We had Vodafone, who also donated money for not only construction, but also for equipment. Now, what is the role of government of Tanzania? The land CCBRT it's actually given by the government of Tanzania, okay? And now we have signed a service level agreement with the government of Tanzania to see how they can also support us, especially for those services that we're giving for free, right? Because any child who's under the age of 5 years who can't afford to pay, we make sure they get the service. We realized most children with permanent disability is because they did not access services at the right time. So they have vulnerable disabilities. This is where we come in, say young before old. We want to make sure that we prevent, because if you have, this is a vicious cycle. You have a child with disability, it becomes a burden in the family, burden in the community, burden in the country, yeah, and then contributing to the economy. So we want to intervene at the right time, so that by the time they go to school, the rest is history. But we want to see how the government as well can support us. I'm having Balotti Mula next week, so we are having those discussions. But in actual sense, also the government of Tanzania really supports the work of CCBRT. And the fact that Her Excellency, the President, who came to the opening, it also shows that they recognize the role of CCBRT healthcare in Tanzania. Yeah. Am I dismissed? Thank you very much.
Did somebody have a question? No. Okay, it's just that when you talked about making sure that, you can't, it's very important so that these disabilities can be reversed. But how do you go about ensuring that you get these children? Because there are other cultural, social, economic factors that make parents not want or not believe that there's hope for children with a disability.
Okay. It's not only children, but it's also the same thing, women with fistula. So what we do, we have intensive awareness creation in our communities. And also we're using the same patients to be ambassadors. So they will see a child from Caroline who has a disability, and all of a sudden now that child can walk. That is a more powerful tool as awareness creation, because they used to see that child with a disability. So we use a lot of that. Same with women with fistula as well, because they do hide, they don't publicize themselves that they have fistula. So it's very hard to find them. I mean, it's a very costly exercise. Each woman costs us to find that woman, to bring, because they don't have money to come for treatment. So you have to pay for that. Yeah, so it is a very costly exercise, but it's the impact at the end that we have in the community. Yeah.
Hello. Yes, it's all about timely, time is of essence. And then quality, timely services, which I think is what you're doing, and it's highly, highly commendable. If there are no further questions, thank you very much, Brenda. And now we break for lunch. When we come back, we will have a presentation from Giselle and Salum Awad as well. But as it's 2 o'clock now, I suggest we break for lunch, and then when we come back, we continue with the presentations. The Secretariat, Doris Pauline, please lead people to lunch now so they know where it's being served and how they can go about getting their lunch then. Thank you all for your kind attention.